Professor Armstrong in SCR 110, Fundamentals of Nursing. We are here today for our students who will be performing the wound dressing change step by step. You can proceed now.
So the very first step is to check the order. So this side over here is the physician's order. So you just have to go down to where you can find for the dry sterile dressing here that we're going to perform. So for this patient, we'll need to perform a clean abdominal wound every shift, right? And it needs to be with normal saline and apply sterile dressing. So we want to make sure it's the right patient and the right order before we get started.
Very good.
Okay, so once we verify the order, we're going to gather our equipment. So that's going to be over here. Make sure your area here is clear. So I have here the dry sterile dressing kit, and it should have the waterproof pad. It should also have gauze, an abdominal pad, saline bottle. It should also have the ID patient label, tape, and forceps. And there's also a clear measuring sheet, which you would be using if you need to measure the incision site. And that's pretty much that. And we also have sterile gloves and 2 pairs of non-sterile clean gloves. Hi, good afternoon. My name is Eillen and I will be your nurse for today. How are you feeling?
I'm good.
Okay, any pain today?
I'm not ready.
Okay, so I'm just going to quickly wash my hands.
And if my patient is experiencing any pain, how do I assess that and what would I do?
I would be using the pain rating scale. So ask the patient based on how the patient's pain feels. Is it a score of 0, meaning no pain, or 10 being the worst pain they've ever had?
And what if my patient has a pain scale of 8? What would you do next?
So I would check the, I would go into the MR and see if I can prescribe medication for the patient.
Good. So you would medicate the patient?
I will be medicating the patient prior to the procedure.
Very good.
Right.
Good.
Okay. All right. So I will be identifying the patient. Okay, so I'm going to just check your identification band. I'm just going to come onto this side. My hands are already clean. Okay, so I'm just going to lift up your blanket over here and just show your wrist. Okay, so over here is where I will be verifying the 2 identifiers.
And what are the 2 identifiers?
Okay, so the 2 identifiers will be the name, the patient's name. So that's going to include the first name and last name, as well as their date of birth. Okay, so can you please verify your first and last name? Nelia Santos.
Nelia Santos.
Okay, and Mr. Santos, what is your date of birth?
01/02/1980.
Okay, great, thank you. All right, so I'm just going to place this back. All right, and I want to make sure that when I was looking at the order that it is the right patient. So according to the physician's order, the dry sterile dressing change is going to be for Mr. Santos. Okay, Mr. Santos. So I'm going to explain to you what it is that we're doing today, and I will be helping you to be in position so that we can perform the procedure. So I'm here today to perform a dry sterile dressing on your abdominal incision site. I will be checking to make sure that your incision site is well approximated, that there are no signs of infection, and just to promote proper healing of the site. Do you have any questions before we get started?
No, I'm good, thank you.
So I'm going to raise the level of the bed, so it's going to be at waist height. So I'm just going to lift up. Okay. Now, Mr. Santos, when I perform the procedure, I'm just going to pull down your blanket and just lift up your gown to expose the area in which I'm going to perform the dressing change, okay? All right, so this is at waist level. Now I need to make sure I clean my table. Oh, and also make sure pull any curtains here. Make sure we provide privacy for our patient here. Okay, so now I'm going to disinfect the table. This is where we're going to be placing our supplies. So I'm just going to use a spray. Okay, and I have a towel. Using a paper towel, of course. Okay, the table is now disinfected and ready for supplies to be placed. So I'm just gonna place that in there. And I have here's our kit on our disinfected surface. Okay, and I will be washing hands next. So I will be washing my hands. Okay, so I have my supplies and my gloves on the table. So I'm going to take out the disposable bag in which we'll be placing the old dressing and any other trash. So I'm just going to, over here, just lift it away from my body. You wanna make sure that the table itself is at waist level, right? I have here the bag, it's this one. And then you'll need tape. I'm just going to close. Okay. So now I am preparing the bag, which will be closest to my patient so that we prevent cross-contamination. Going to bring myself closer and the table as well. One more. Make sure that the bag and the tape is well adhered to the table. And now I will be pulling out 3 pieces of tape. These pieces of tape will be used towards the end of the procedure when we are placing the dressing pad on the patient. So about 6 inches per tape. And you should have it placed at the edge of the table like so. One more. Okay. And so we're going to go over to the patient. This is where we're going to remove the dry dressing. Before you do that, make sure your hands are clean. And then, once your hands are clean, put on your non-sterile clean gloves. All right. Okay, Mr. Santos, I'm going to pull down your blanket from here and also lift up your gown so I can see your dressing so that I can perform the change, okay? So make sure as you're pulling down the blanket and exposing the area that you are going to perform the procedure, you want to provide comfort to the patient. Make sure you're not pulling all the way down or you don't expose too much. You want to keep the patient warm and comfortable at all times. Okay, thank you, Mr. Santos. So over here, I have exposed the area in which the procedure will be performed. Okay, so with my non-sterile gloves, I will be removing the old dressing, and from there I would be assessing both the old dressing as well as the surgical insight, and I will guide you as I perform so. So as you are removing the tape, make sure you do a pull and push down method. You want to be mindful of your patient's skin integrity as you're doing so please be very gentle. Okay, so
let's demonstrate how this is done.
Okay, so I have a piece of tape here. So have one hand pinched at the strip of the tape. So as this one is pulling away, you're going to use one finger to press down on the skin.
Excellent.
Are you doing okay, Mr. Santos?
Excellent.
Okay. Okay, so that area is lifted. Okay, over here too, be very gentle. Just to loosen the areas. Okay. So as you lift, you have the dressing. You're first assessing the dressing itself. You want to make sure that we have in mind COCA, which is color. If there's any color of like purulent, if it's like there's any signs of pus, if there's any blood on there, you just want to be mindful of those things. And so just be mindful of the color. The next thing you're going to think about, is there any odor? So is there any odor coming from the dressing, which would indicate infection? And then consistency, you want to see if it looks runny, or if it's slimy, or if there's a lot, and then the amount, and you want to make sure that is the pad itself overly saturated, or it's just very minimal discharge. So make sure you close this, throw this in the trash. Now I'm also looking at the incision site. You want to be mindful of where the incision site is. So in this case, Mr. Santos has his incision site on his abdomen. You want to be mindful of how well approximated the incision is.
And what does that mean?
So well approximated means that both sides of the incision site are well close together. Right, so whether that's through staple or through sutures, you want to make sure that you have those two areas closed.
Okay.
So you want to make sure that is what you see in the site. Also check for any signs of infection, if there's any redness, any signs of inflammation, and you would definitely note any of those things in the chart when you're recording your assessment. Okay, so from here, I'm going to remove the gloves. Wash my hands. Now it's time for us to prepare our sterile field. So making sure you have a pinch at the end of this flap here. Open the kit away from your body. And using a pinch of your index and thumb, you're going to lift up the sterile pad. So this is going to be the under part of your sterile field. Now be mindful that the sterile field, there's an area in which if you place any objects or even your hands would be considered contaminated. So that would be the 1-inch border around the sterile field. So please, just make sure that center is the best, and that's where it's sterile. Outside of the 1-inch border, that's contaminated. Okay, so I'm going to, I have the gloves over here. Okay, so now I'm going to open my package. Mm-hmm. Okay. So take your hand that is the dominant and place your hand underneath. You want to make sure that as you're placing your hand that it's not touching the outside. The outside is considered sterile. So just be mindful of that. So at this point, I am touching only the inside. So as you open your package of the sterile gloves, you're only going to, it's okay to hold and touch the inside of the glove. Okay, so as I pull down. Okay. Now, applying the glove on the other hand. So you're going to take your sterile glove here and you're going to go under the cuff.
Sterile to sterile.
Sterile to sterile.
Okay. Excellent.
And just sure. Okay. So now you have your sterile gloves on. And then you can remove and discard the package.
Good.
Okay. So let me just make sure. Okay. So as you have your sterile gloves and your sterile pad and your field is created, you're going to remove the kit contents onto the pad here. So that includes the solution, a roll of gauze, another pair of gloves, just in case. This is for measuring the incision site. If there's like any signs of erythema or any swelling, you would be using this on the site and you would be measuring. But in this case, we are just going to put it to the side.
So in a case like this, if we have to measure a wound, we want to check to see if the wound is healing, right? Depending on how deep it is, the depth, the width, right? Good.
Yes. Okay. Here is the dressing pad, forceps, 4x4 gauze.
And how many are there? About 6, I think.
There are about 6 in which we're going to separate 3.
Yes.
So each of the 3 separated gauze will be for cleaning the site.
Excellent.
So I have one here. Two and 3. And then you have a label, which you would be placed at the end of applying your new dressing. Okay, so now we're going to pour the solution. So I have here the solution that we are going to be using. This was also mentioned in the physician's order that we would be using the normal saline, which is sodium chloride, 0.9%. Now be mindful as you are opening the solution.
Is there anything else you should be observing? Should you look for anything? Expiration
So
date?
you want to make sure that the expiration date, make sure that it is not expired, that it's not opened, and
Doesn't have any sediments.
doesn't have any
it's not
sediments,
cloudy. Very good.
any change of color,
Excellent.
and you want to make sure that the label is also still intact.
Good.
So I'm going to remove the cap. Be mindful of how you place the cap. You want to make sure that the inside of the cap is facing up, facing to the ceiling. It's not facing downward, so that would be considered contaminated. So placing that here. As you pour the solution into the container here, you want to make sure that the label is facing inward inside the of your palm here. So as you're pouring, if there's like any small leakage, you don't want that to ruin the label of the solution here.
Excellent.
So I have here, so I have the solution. I'm just going to be pouring. Okay. Close the container. Okay. So from here, you will begin cleaning the site. So take one gauze at a time.
Which is your dominant hand, which is your sterile, which is your non-sterile hand.
Right. So as you are cleaning, you want to be mindful of cross-contamination. So from here, you will need to assign which hand will stay close to the sterile field and which hand will stay close to the patient. At all times, as you're cleaning the site, those hands need to be in those areas that you assigned. So my hand here, this is my left. So this will be closest to the sterile field. So this is my sterile hand. So over here, I put the gauze into the container. You don't want to overly saturate the pad. And if it's overly saturated, just push to remove as much excess. Now, you want to make sure that it's not dripping as you are bringing your sterile hand with the gauze over your sterile field, because that will also contaminate the sterile field. So as I am passing my sterile hand with the gauze over to my clean hand, you want to make sure these two hands never touch. So you're going to clean the area 3 times. You start medial, so that's going to be at the center. You want to start from here, from the top of the surgical incision, moving your way downward. It's just one swipe. So I'm going to perform. Okay. And then to the garbage. Okay, so now with my second gauze, I'm going to clean distally. So that's going to be on this side, close to the incision. Away
From you. Good.
here. And trash.
Excellent. Excellent.
Now with your final gauze here.
Good.
You're going to clean proximal. So it's on this side.
Very good. Excellent.
Okay. So now we have cleaned the site. It's now time to apply some gauze. So we're going to apply 3. You want to apply enough so that you cover the site. So in this case, Mr. Santos has the abdominal incision over there, so about 3 would suffice. And still maintaining your hand that's sterile on the sterile field, on the sterile side, and keeping your clean close to the patient. So separate. Your gauze. And now we're going to cover the incision. Do not press down on the gauze. Okay, the site is now covered. We are going to now apply the dressing pad.
And at this point, both hands can actually work, right?
Since we have the site covered,
Yes.
you may use both hands at this time.
Yes.
So it's a good indication. We have a blue line here. So the blue will be facing upward. So blue to the sky. Cover the area. Okay. And from here, you would be applying your 3 pieces of tape. On the top. Okay. Almost done, Mr. Santos.
Okay.
One in the middle. Last one. On the bottom. Okay, so now the site is covered and there's a fresh pad on top. So now we're going to remove the gloves. We're going to clean the area. And make sure that as you are cleaning up, you apply your label. So you want to make sure that you include your name and your credentials. You want to include the date and the time that you performed the dressing change and what kind of dressing was performed. So in this case, we performed a dry sterile dressing. You could just simply put DSD. Okay, so let me wash my hands a little bit. Okay, Mr. Santos, all done. How are you feeling?
I'm feeling much better.
Okay, so I'm going to bring down your gown.
Thank you.
Keep you covered. Here, I would clean the area, make sure that everything just goes to the trash. That includes the container as well. So that would go into the trash. This is in the garbage, and I will make sure that I wash my hands. So I'm just going to place this here for the moment. Okay, wash my hands. Clean the area. Okay.
All safety measures are in place.
Okay, so Mr. Santos, I'm going to, let's make sure you're covered well. Okay, I'm going to lower the level of the bed now. Now, Mr. Santos, I'm going to step out so that I can document the procedure I was performing just a moment ago. As I exit the room, is there anything that you need before I leave?
No, I'm fine, thank you.
Okay, Mr. Santos. Now, Mr. Santos, it's very important that you also receive your call light. If there's anything you do need, you can press the button. So I'm going to place it on this side. So there's a button over here, Mr. Santos. Press on it in case you need anything, and someone will be here to help you.
I will, thank you.
No problem, Mr. Santos. Okay, so now it's time to step out. From here, you're going to document the procedure, when it was done, what did you do, where was the incision site. If the patient was in pain, you want to make sure that is documented as well. What did you do to help with that patient's pain? And how well did your patient tolerate the procedure? That's very important to mention in the documentation.
Thank you.
Okay.
Excellent.